Firefighters in the city of Chandler are being told to peel back a few more layers when it comes to asking questions to patients. Reporter Nicole Gutierrez tells us how one grant is helping the city's fire department recognize behavioral mental health calls.
Firefighters are often the first ones to give service to the public in emergencies. They also help in hazardous situations and, of course, fight fire. But the Chandler Fire Department says they receive more medical calls than any other call.
In the state of Arizona, less than 10% of the 911 calls that go to the fire departments are actually for fires.
Firefighter in the city of Chandler will now go through 4 hours of behavioral health training.
There was times when we got back into our engine, talked about the call, and just didn't feel like we were really advocating for the patient properly. We have realized that there are some somewhat flaws to the system as to how do we navigate behavioral health patients to the proper place and not an emergency room.
The Chandler Fire Department was given a $125,000 grant from the Vitalist Health Foundation in hopes of creating crisis support training to help firefighters communicate better with patients.
So there was a real disconnect with the training requirements for paramedics and what they're actually seeing in the field.
The 4-hour training will be used to better recognize the type of help a patient may need.
To make sure that our firefighters could at least recognize when they were dealing with someone that was in a mental crisis or a behavioral health crisis, and differentiate between someone that had a substance abuse issue or a mental health issue.
Blas Miner, the public information officer for the department, says the training will help de-escalate future emergencies and put patients on the right path.
And if we could just answer that question, and be able to navigate them in the right direction, I think we've done our job with the 4-hour training.
In Chandler, Nicole Gutierrez, Cronkite News.
The Chandler Fire Department says the behavioral health and crisis training could soon be available for other departments to use as well, not just here in Arizona, but across the country.